Oklahoma City, Oklahoma, USA. We're here for you today at Optimal Health Associates. I want to talk to you guys about cardiovascular disease. 1 in 4 women in the United States dies of cardiovascular disease, and 1 in 5 wait long periods of time to even notice that they have any kind of disease. So what we're offering here at Optimal Health today is something called the SmartBeat risk assessment tool. And I'm here with Leah and Jessica. Say hi, guys.
Hello.
They are our technicians that kind of drive this boat. And so what I want to show you guys today is what's all involved in the SmartBeat tool, and kind of what kind of report is generated and what kind of information you can take back when you get the report from us, your doctors, and how you can take that to other physicians or other providers to help prevent your risk of cardiovascular disease. So essentially, what the SmartBeat is a conglomerate of cardiovascular risk assessment tools. So I kind of picked these guys' brains because they're the pros. So the first thing a patient will expect to do when they come in for a SmartBeat is
The PFT.
a PFT. So can you tell our friends at home what a PFT is?
Sure. So basically, it's a lung function test. We're going to see how big your lungs get and how much we can get them to compress to make sure there's no kind of restriction. It checks for asthma, COPD, those sorts of things.
Right. So have you ever had any problems with your breathing, or you ever feel short of breath, this is kind of your first stop to figure out what's going on there. So after we check their lungs, then what?
Next, we'll do the EKG.
Okay, and most people know what an EKG is, and if you kind of pan around the room, you can see we've got our table set up. So I actually had my test a few weeks ago. They laid down a table, they put all the stickies on you, and you get a heart tracing, and that kind of gives us a general information of your current cardiovascular pulse risk. And then after we do the EKG, then what?
Then we'll do the ultrasound. So we'll look at the carotid arteries in the neck, checking for any kind of plaque buildup. We'll look at the abdominal aorta in the stomach region, looking for any kind of aneurysm, and we look at the heart laps to make sure function looks good and how the valves are doing.
Right. So where else can you go in Oklahoma City? Get an EKG, get a pulmonary function test. They'll check your carotids in your neck, make sure you're not going to have a stroke. They're going to look at your heart, make sure you're pumping out enough blood. What did I miss? Oh, occasionally they'll screen for thyroid if you're lucky. What else?
So after that, we'll do some blood pressures, and then we'll do the CBP. So we'll be checking the arterial flow and making sure there's no hardening of the arteries.
Right. So why is that important? It's a little better test than just getting a calcium risk score. So for those of you out there that have ever seen a physician to try to check your what they call atherosclerotic disease, they can look at how squeezable or how compressible your vessels are. They're supposed to be nice and compliant so the blood moves through quickly, and they can dilate and contract when you need them to. If they're nice and hard, that's not a good sign. And so this is an easy way to screen for that. And then I think, what's the next step? Do we check the eyes after that?
Yeah, we can do the retinal scan.
Yeah, so how cool is that? Most of the time you have to go to an ophthalmologist. Nice. But here they'll do it right here in the office. We don't even have to dilate your pupils. They take a nice photo of the retina or the back of your eyes. Those are the smallest vessels in your body. And so they're going to be the first to show any kind of cardiovascular changes, either from high blood pressure or atherosclerotic disease. And then I believe after that is when they make you do a little bit of work.
Yeah, so we'll do exercise last, and then we'll recheck the blood pressure. We're just making sure that it's not spiking or plummeting with exercise.
Right, and don't worry, it's not like you're going to be doing a high intensity interval training session. It's 3 minutes of step ups. Even I made it through it. And check your blood pressure. Make sure that you respond appropriately. It should go up a certain level. It shouldn't drop, or vice versa. And make sure that you're safely responding to increased activity. And then after that, I think that's the last test. After that, it takes about a week, but we send all the results to specialists, and they look at each piece individually, and they put that together to give you a risk score. It will essentially tell you your risk of diabetes, heart attack, stroke, and is that it?
Heart failure.
And heart failure over the next 4 to 10 years. So the goal here is to get some information that we can arm you with to try to prevent medical problems and be more progressive in prevention, and not have to worry and be so reactive on the back end when it's already a problem. So hey guys, thanks for joining us. We'll try to post some more videos of other cool things we're doing here in the clinic. Remember, Optimal Health, this is where life starts. And I'm Ben Barbenberg, Oklahoma's pelvic health expert. Thanks.